Coming up on this episode of SIVA TV, we make homemade soap, mask up, and have COVID-safe gatherings. Stay tuned for all of this and more on SIVA TV.
There's an audience that you can't really show with words on a paper or on a poster, but it's kind of this.
And remember, there's always good news around the corner.
And try not to get frustrated. It gets easier.
Welcome to Mandiox News. I'm Vanessa and I'll be your host today.
And while that is heating up, you're going to want to lay out all your ingredients.
I have never done a documentary ever in my life, and this is my first documentary.
This is going to be quite the video.
Hello and welcome. My name is Kaser and you're watching SIVA TV. This is the show where we feature educational videos made by student producers all across Sacramento County. We will take a look at some of the best videos submitted to the Student Educational Video Awards, and we'll even take you behind the scenes to talk to the producers themselves. So sit back, relax, and enjoy the show. As vaccinations for COVID-19 continue, it's important to look back and remember everything we have learned in response to this pandemic. Harper and Nicole demonstrate a few suggestions to remain safe from the virus.
I'm Harper, and I go to Markoffer Elementary. My video is called COVID-19 Informational Video. Me and my friend Nicole go over how to stay safe in coronavirus. My favorite part was when we gone over 6 feet apart. Important to stay 6 feet apart. This is what 6 feet looks like. The video means to me a lot, and I just love doing the videos. They're so fun and entertaining. Hi, I'm Harper.
And I'm Nicole.
COVID-19 has been affecting us all year.
Schools are closed.
Restaurants are closed.
You can't visit friends and family.
Life is hard.
It's so important for all of us to do our part and stay safe and healthy.
Today we are going to go over how to stay safe and connected with friends. Did you know that germs can travel up to 6 feet? That's why it's so important to stay 6 feet apart. This is what 6 feet looks like. If you can touch your friend, you are too close. There's a right way and a wrong way to wear a mask. As you can see, this mask is way too big, so it will not protect me. This mask is a great fit. It's nice and snug, and it will keep the germs out. Washing your hands is really important to stay safe and healthy. Make sure you have soapy water, and make sure you wash for 20 seconds. Sometimes I like to sing happy birthday 2 times. Those are the most important ways to be safe and healthy. Here are some ways to stay busy and also connected with friends. Be a pen pal with your friend and send them a letter. Or go for a bike ride. Read a book. It's really fun to Zoom your friends. How are you, Harper? Good. Thank you so much for listening to our public service announcement. For more information, please visit cdc.gov and covid19.ca.gov.
If you test positive for the coronavirus, it's important that you self-isolate at home and consult your regular physician over the phone before going to the hospital. Keep watching to find out what it's like to test positive for COVID-19.
Hi, my name's Paige. I'm 9 years old, and I'm in 4th grade. And guess what? I got COVID.
We just thought, there's no way that we have COVID. You know, you see it on the news, you hear about it. We've been really careful. There's no way we have it.
Here's how it all started. My sister, Sophia, who's 12 years old, who is special. Her caretaker, who is following all the protocol, rules and all that. Sophia was exposed on Monday and nobody knew.
Sophia, where she goes to her care facility where she got exposed, they are so careful. They wear masks, they clean. Everything is so careful. So we thought, no, even her pediatrician thought, no, you guys are fine. Just get tested just in case.
Like, we had no idea Sophia had COVID, and like everything was normal. Like, we got our flu shots, like we visited some people, like everything was normal. Fast forward to Saturday night. Sophia was not feeling well. This was not really surprising because sometimes she gets like an ear infection, so we just thought it was that. So Sunday, pretty much after that, Sophia had a low fever, and we just shut everything down. We like stopped visiting people. We wouldn't let anyone visit us. We didn't think anyone had COVID, but we just thought we were gonna be safe. So Sophia's pediatrician said that we should get Sophia tested just in case. Monday afternoon, she got tested. It was a whole week after she got exposed, and we still had no idea. Monday night, we got a phone call, and we realized she was exposed. Tuesday night, 7 o'clock, I did not start feeling well. And I just felt like really cold, so I curled up on the couch. So I started feeling warm, and I asked my mom for some medicine, and I never asked for medicine.
The minute I saw Paige on the couch not feeling well, her cheeks were pink, just laying there, and she told me she wasn't feeling well and she needed medicine, I thought, oh goodness, is it possible we could all have COVID?
Mom and Dad pretty much knew at that point, if I'm sick and Sophia's sick, we're all sick. Wednesday was my worst day. That day I didn't really feel that well. I was just like laying on the couch pretty much the whole day. I was a lot tired. I was hot, and I was a bit achy. Later in the afternoon, my mom made me go outside, get on the patio, get some fresh air. I ate some soup to help me get better, and I drank a lot of juice. That night, I did feel a little bit better, but then my parents weren't feeling well.
But it was hard on Paige because she couldn't really understand. The rest of us were still sick, and she was fine.
Wednesday night, Sophia's test results came back, and they were positive, and I was freaking out. I was like really worried about my family. I don't know if we're gonna live or we're gonna die. I was really worried at that time. And I told my mom, are we all gonna die? Because I was super scared.
I think one of the hardest parts was when my daughter asked me, you know, am I gonna die, Dad?
My mom, Dad, and myself had to all go over and get tested for COVID. So Thursday afternoon, that day, at 2 o'clock, me and my family went to go get tested.
Hey guys, I'm gonna get tested for COVID. So let's see if I am negative or positive. I'm nervous because I don't know if I'm gonna be negative or not negative. Someone in my family has it positive, so kind of feel like I have it, so we'll find out. Gotta get my mask on because we're getting close to getting me and my family tested. So yeah, I gotta put my mask on to get tested. I'm a mask in and we're going in the place where I get tested. See you soon. It wasn't as bad as I thought. All they did was stick a Q-tip in your mouth and up your nose, so it wasn't that bad actually, so yeah. We'll find out the results soon.
So when I went to go get tested, they kind of like stuck like a overlarge Q-tip in my mouth, which kind of didn't feel well, and up my nose, so that didn't really feel. I thought like the germs in here would go in the germs in here, so I didn't really know how to do that.
Getting tested really wasn't too bad. It was quick and easy.
And the weird thing about that part, I was feeling much better.
Paige only had symptoms for 24 hours. Literally after the 24 hours, she was fine. The rest of us, not so much. You know, 4 or 5 days for Sophia, 4 or 5 days for myself as well.
And I had it for almost 9 days of aches and pains. I had the worst of it.
Yeah.
I was like feeling feeling normal. I was like playing with my dolls. I was like, feeling normal. 2 days later, on Saturday, the test results came back and we had COVID.
So we just got the test results. I am positive, which is not really good. My mom and dad are positive. My sister is positive. So my whole family's positive. I'm feeling actually fine. My parents not really feeling well. My sister's not really feeling well. So yeah.
Luckily, my sister Sophia was feeling a bit better because she was sick for 5 days. My mom and dad, they were sick longer. My dad was sick for 8 days straight.
We had a really good support system of doctors calling us daily and helping us, so I think that really helped.
We all had different symptoms, but none of us actually really got it bad.
You and I both have some lasting effects, but the girls, especially Sophia, came out okay. Paige was a trooper. Our family was really lucky.
It was really hard because I couldn't see anyone. Like, I couldn't see my grandparents, or I couldn't go to the grocery store. It was really hard.
Just having our grandparents live literally right next door and around the corner, and you can't go see them. Friends that we were quarantining with, just, spending a little bit of time with, nope, you can't see them. That was really hard on Paige. It's hard for a 9-year-old to know that I'm not sick anymore, but you really have to stay away from people.
Another day of quarantine. I'm still quarantined since I have COVID, along with my family. So, yeah, I feel fine. My temperature's fine. I have COVID, though, for some reason. So, yeah. See you soon.
Paige was definitely getting cabin fever. She really was starting to go a little bonkers. Luckily, we live out in the country, so she could ride her bike around outside, but just literally not being able to go anywhere was rough on her.
It's another day. I still can't believe I have COVID. This is kind of tiring. School online is okay. It's getting better. I will say that. Getting more used to it. So yeah.
The best part about this whole awful thing, everyone we came into contact with, thankfully, they did not get COVID.
And we were able to contain it just to the 4 of us.
The hardest part, honestly, for me, was not seeing my friends for 10 days. Because that was really hard, because usually my friends come over.
Especially with all our family living so close by, it was hard not to see them during the quarantine time.
Hello, it's another day. I'm feeling way better. I feel a lot better. I don't feel like I have COVID anymore.
But we managed, and we eventually got better, which was good. This whole experience of COVID, gotta say, it was hard for each one of us, and just watching it on the news was also pretty hard that my family got COVID too. Thankfully, we're all doing better, and I hope this COVID ends soon. Everybody stay safe out there, wash your hands, and put a mask on while you're going out in public. Thanks for watching, and everybody stay safe out there.
Whether you've already received both doses of the vaccine or you're trying to decide if it's right for you, then listen up, because Anson speaks with a doctor of infectious diseases to understand what the vaccine is and how it works.
The name of my video is COVID-19 vaccine. In my video, I describe how the COVID-19 vaccine works, how the COVID-19 attacks the body, and why the vaccine works and why you should take it. I want viewers to learn from my video that taking the vaccine isn't scary and it's better than getting sick. My favorite part in making my video was traveling around Sacramento, filming with my grandparents and my mom. What I've learned from making my video is that I shouldn't wait till the last minute, because I had one person to interview, but that person didn't respond back, so I had to quickly change interviewees. So I learned that I shouldn't procrastinate. And the video means to me, like, I feel like producing that video, it kind of makes me help the community a lot more than just kind of sitting around and playing. In the past year, life has changed drastically due to the COVID-19 pandemic. Kids across the country have lost social interaction by not participating in school, on campus, or other curricular activities. Several companies released a COVID-19 vaccine in late 2020 in the hopes of stopping the spread and getting back to normal life. With much apprehension about taking the vaccine, I reached out to an infectious disease doctor to learn more about COVID-19, how it spreads, and why the vaccine works.
So I'm an infectious diseases doctor. I take care of people with infectious diseases, and I'm also the medical director of the California Department of Healthcare Services.
Dr. Karen Mark is helping to make a difference during the COVID-19 pandemic.
Our department runs the Medi-Cal program, which pays for doctor's visits and other health care for about a third of all Californians, including about half of all kids. So about half of all kids that go to your school. And I'm working with other people in the department to help make sure that we can get the COVID vaccine distributed to everyone on Medi-Cal. The COVID-19 is a virus, and it travels from one person to another in little droplets. So when someone who has COVID coughs or sneezes or talks or even just breathes, little droplets come out of their mouth with the virus. And those droplets can land on someone else's mouth or nose or eyes. And that's how that second person gets infected with the virus. That's why we wear masks, because the mask prevents the droplets from touching your mouth or nose. And like if I have COVID and I wear a mask, then it keeps the droplets all with me so they don't travel to other people. One of the ways that our bodies protects us from all infections, including COVID, is we have something called an immune system. And our immune system, when it sees COVID, we have some cells that like gobble it up. We have other cells that like see the virus and they say, oh, I know that's not part of me. And then they put a little flag on it. And then other cells will like kill those cells with the virus. And that's how our body fights infections. But it takes several days to several weeks for our bodies to develop that immune system. And after we have COVID and after we develop that immune response, we have certain memory cells that always stay with us and remember that virus. So if we get all better from COVID, we have those memory cells, and that helps protect us from getting COVID again. The vaccine works because it tricks our body into thinking we have the virus, even though we don't. The coronavirus actually means crown. And that's because the virus has these little spikes on it. And the COVID vaccine has a little code that creates just like one of those little parts of one of those spikes. So when we get the COVID vaccine, the body makes just that little part of the spike. And then our immune system recognizes that it's not part of us. And then it develops that whole immune response to it, and it develops those memory cells so that we have those memory cells, so that even though we didn't get sick from the vaccine, we still have the memory cells and we can fight off, if we get exposed to the actual coronavirus. So before the vaccine was distributed to the public, it was tested in lots and lots of people to make sure that it was safe and to make sure that it works. And it passed all those tests. So it showed that the vaccine works and that it is safe. All that data from all those trials were also reviewed by the Federal Food and Drug Administration and also the Federal Centers for Disease Control and Prevention. And they both also determined that it's safe. Getting the vaccine is a lot safer than getting COVID. So I'd rather have like a little bit of a sore arm for a day than, get really sick from COVID or maybe get COVID and pass it on to someone else. I've gotten the vaccine myself and it wasn't bad. I got a little bit of a sore arm, but other than that, I had no side effects at all. And I will also share that as soon as I could get the vaccine for my mom and for my kids and my other family members. I'll make sure they get the vaccine as well. So I feel very confident that it's safe. I just want to remind everyone how important it is to continue to wear a mask and stay 6 feet away from people and wash your hands. Even after people get vaccinated, we have to still continue taking those safety precautions for a while.
Encouraging the adults in your life to get vaccinated, kids can get back to learning on school campuses. They can take part in extracurricular activities and begin socializing like they did prior to the COVID-19 pandemic.
There's no need to worry about running out of soap. Unlike toilet paper, you can always make your own soap right at home with just a few ingredients. Malia shows us how.
I'm going to show you how to make something that you use every day. I'm talking about soap. Soap is especially important now during the COVID pandemic because it helps kill viruses and bacteria that are on your skin. It is very easy to make. I'll show you how. You will need shea butter, scent, coloring, a measuring cup, and a soap mold. The first step in making soap is cutting the shea butter soap into squares. 2 squares is best. The important ingredient in the soap is glycerin because it adds moisture. Next, cut a square of soap scent. I've chosen avocado cucumber scent. Add the shea butter and scent to a cup for melting. Okay. Melt on high for 30 seconds. Remove the melted soap. It should be completely melted. Then add a color that you like and any other accents like glitter or dried flowers. Stir them together until they are well mixed. Lastly, pour the mixture into the soap mold. Wait until it is completely hardened. When the soap is hard, take it out of the mold and you have homemade soap.
It's always a good idea to play it safe. So wear a mask and follow these instructions to ensure your mask is properly secured.
The name of my video is Mask Up. Mask Up is a video that informs the audience watching this news story about how to correctly wear a mask and how to do that and why. With this ongoing pandemic known as COVID-19, it's important to remind our community how to protect both themselves and others. This video can inform my friends and community of why we are wearing a mask and how we can wear a mask properly to protect our loved ones and from feeling as if the world was falling apart.
Here are a few safety tips on how and why you should mask up from a local healthcare expert.
Hi, my name is Kendra. I'm a registered nurse here at one of our local hospitals, and I also teach clinical nursing at one of our local schools. Today, I'm going to tell you the importance of wearing a mask, why we should wear them, and I'm going to tell you about 2 different masks, surgical and an N95. So we are wearing masks to protect each other from COVID. You wear a surgical mask to protect someone else, and the N95 will protect you. So to wear surgical mask, which is this, you just put these around your ears, put this above your nose and under your chin and pinch. You don't want to touch the outside of your mask with your hands, and before taking them off you want to wash your hands and just touch that part of your hand or that part of the ear thing. So that's a surgical mask, and that will protect someone else if you are asymptomatic, or even if you have symptoms, you wearing a mask will protect someone else. This is what we call it N95, and these are what doctors and other healthcare professionals such as myself wear to protect ourselves from patients who are positive for COVID. So this, you put on like this. And then you take this one and go all the way back behind your neck. And again, pinch so you have a perfect seal around your face. To take it off, like that, and like that. And we wear these to protect ourselves from people who are positive for COVID. Please wear your mask, not just for yourself, but for your loved ones, for our friends, and for our neighbors.
My name's Tania, reporting for Wildcat TV.
When you are ready to start hanging out with your friends and family in person again, you may decide to continue practicing social distancing if some of you have not been vaccinated. So here are a few ways to hang out while keeping each other safe.
How to have COVID-safe gatherings. As we all know, the best way to hang out with friends during this pandemic is through Zoom. I'm guessing you've already been doing that for the past year or so. So, if you want to see a friend, or maybe even two in person, here are the steps on how to do it safely. Step 1. Before planning your hangout, check if you have any COVID symptoms. That includes, but isn't limited to, fevers, the loss of taste, the loss of smell, or even headaches or fatigue. Step 2. Once you're 100% sure you don't have any symptoms, schedule your hangout, but try not to set your location at a coffee shop, the mall, your house, or anywhere inside. Outside is better because air can circulate, and it has a lot more ventilation than you would have inside. Step 3. Before you meet up with your friend, pack food if you plan to eat. It's best to bring food from home and not share to lessen the risk of getting the virus. Step 4. When you meet, stay 6 feet apart at all times, whether that means having a socially distant picnic like this, riding your bikes around the neighborhood together, or even playing online phone games like Minecraft, Among Us, or Roblox. But really, anything outside will suffice. Step 5. Be mindful about when you take off your mask. If you're eating or doing something like that, it's obviously okay to take it off. Just remember to put it back on once you're done. You may even need to have your friend remind you to. Step 6. Skip the goodbye hug. I know it sucks, but we have to stay 6 feet apart at all times. So, give your friend a wave, or even an air hug. Step 7. As soon as you get home, before touching anything else, wash your hands with soap and water. But just a reminder that this clip is sped up, and you should be washing your hands for at least 20 seconds. So count to 20 or even sing a fun tune. And you're done! Now you know how to have COVID-safe gatherings. Stay healthy and wear a mask!
Well, that's all the time we have for today's episode of SIVA TV. Thank you for joining us, and remember, if you'd like to see more student videos or find out how you can enter the SIVAs, check out our website at secctv.org. I'm Kaser, and thanks for watching.